Now in this video we will see the anatomy of the pericardium. So pericardium is the outermost covering of the heart. In the pericardium we have two layers, that is the fibrous and the serous layer. So this is the fibrous pericardium, which is the tough layer enclosing the heart, and it is located at the vertebral level of T5 to T8. Anteriorly it is located in front of the body of the sternum and second to sixth costal cartilages. So this is the position of the fibrous pericardium. And now the attachments of the fibrous pericardium. Superiorly, this fibrous pericardium, it is continuous with the adventitia of the great vessels of the heart, that is your aorta, pulmonary trunk and the superior vena cava. And inferiorly it is attached with the central tendon of the diaphragm. So inferiorly we can see this is the diaphragm and this is the central tendon of the diaphragm over where this fibrous pericardium is attached. It is very adherent to the central tendon. Why? Because there is common origin of the diaphragm, that is the central tendon of the diaphragm, and the fibrous pericardium from the septum transversum. So both these structures, they are developing from the septum transversum. Now laterally this fibrous pericardium is related with the phrenic nerve. This is the phrenic nerve which is supplying this fibrous pericardium, as well as the diaphragm. On the lateral side we have this relation, along with the blood vessels. The blood vessels which are running with this nerve, these are the pericardiophrenic vessels. These are the artery, that is the pericardiophrenic artery. This is the branch from the internal thoracic artery. Now after giving incision, a horizontal incision is given at the base of the heart for removal of this fibrous pericardium, and the two vertical incisions are given at the lateral aspect of this fibrous pericardium. After giving these incisions, we have reflected the fibrous pericardium, and now we can see the inner layer, that is the serous pericardium. So the serous pericardium, it has two layers. One is the parietal layer, this is the outer layer which is surrounding the inner aspect of the fibrous pericardium, and this is the visceral layer which is surrounding the inner surface of, that is the outer surface of your heart. So this layer is also known as epicardium, which is also the visceral layer of the serous pericardium. Here we can see, after removal of your fibrous pericardium, we can see the chambers of the heart. So this is the right atrium of the heart, this is the right ventricle, this is the left ventricle, and this small portion, this is the left auricle, which is a part of the left atrium of the heart. Now we come to the sinuses of the pericardium. We have two sinuses. What are sinuses? Sinuses are the reflections of the serous pericardium at the great vessels of the heart. So these sinuses, these are two in number. One is transverse sinus, other is oblique sinus. So this is the oblique sinus which is located beneath the heart. Beneath your left atrium we can see the oblique sinus. So this is the position of the oblique sinus. So my fingers are inserting in the oblique sinus. So the boundaries of the oblique sinus, this is bounded superiorly by the left atrium and anteriorly by the left atrium again. So it is located behind the left atrium, and on the right side it is bounded by the inferior vena cava. This is the inferior vena cava, and above we have the pulmonary veins, that is the right pulmonary veins on the right side, and on the left side we have the left pulmonary veins. So these are the left pulmonary veins on the left side. This jelly like material over here we can see, this is the pericardial fluid. I have inserted my this forceps in the transverse sinus. So this transverse sinus, it is located behind the pulmonary trunk. This is the pulmonary trunk. So the transverse sinus is bounded anteriorly by the pulmonary trunk and the aorta. This is aorta, and posteriorly it is bounded by the superior vena cava. So this vein is the superior vena cava. Inferiorly it is bounded by the left atrium. So this is the left atrium, and superiorly it is bounded by the bifurcations of this pulmonary trunk. So pulmonary trunk is bifurcating into left and right pulmonary artery. So this is the transverse sinus. The clinical importance of this sinus is that if you want to surgically approach the heart, you have to ligate these great vessels of the heart. So these great vessels, that is your pulmonary trunk, aorta and the superior vena cava, these can be ligated at this transverse sinus. And the clinical aspect of this oblique sinus is that there is dilatation. In case of dilatation of the left atrium of the heart, this oblique sinus provides a space for the dilatation of the left atrium. So on the dilatation of the left atrium, posterior to the left atrium, we have the esophagus that will be compressed, and this lesion is known as Ortner syndrome. So here we can see this phrenic nerve which is supplying the innervation to the fibrous pericardium, and the serous pericardium, it is supplied by the cardiac plexus. The blood supply of the fibrous pericardium is by the pericardiophrenik vessels, and the blood supply of the serous pericardium is by the branches of coronary arteries. Thank you.